Michael Varanian. I'm with Johns Hopkins Hospital, Department of Medicine, and I did a poster on the interaction of fitness, obesity, and cardiometabolic risk. So we took roughly 2,600 Brazilian people from São Paulo, and they were sent for an employee-sponsored health exam that included blood work, included an ultrasound for hepatic steatosis, and included an elastad treadmill stress test. So we wanted to look at how cardiometabolic risk and how fitness interacted. Some of the outcome data have shown that basically those who are fit yet fat have lower all-cause and lower cardiovascular mortality than those who are thin yet unfit. And so we wanted to see how the cardiometabolic risk panels that people would order in a normal clinic compared to what we see as the outcome data. Essentially, is fitness protective? So at first we looked at cardiometabolic risk in those who were obese and overweight, and we saw that as people got to higher levels on the elastad stress test, essentially those with higher fitness had lower cardiometabolic risk. CRP, glucose, systolic blood pressure, LDL, HDL, metabolic syndrome, steatosis, and triglyceride to HDL ratio were all statistically significant, showing that of those who were overweight and obese, those who were more fit had lower cardiometabolic risk. Then we took just a fit population. So of those who were fit, we wanted to see if we put them into BMI quartiles, essentially of those who were fit, if we stratify them based on fatness per se, if the cardiometabolic risk got worse. And we saw that as people were fatter, yes, it did get worse. So basically, again, everything that we talked about in the first table was statistically significant. CRP, glucose, systolic and diastolic blood pressure, LDL, metabolic syndrome, steatosis, and we also included Framingham risk in this. Finally, we wanted to look at the discordant pairs. So those who are fit and fat compared to those who are thin but not fit. And in doing that, we wanted to see whether fitness was protective or whether it was fatness that was driving cardiometabolic risk. And what we did find for, again, all of those things that we measure is that fatness actually was driving it. So when we look at the long-term outcome data, we see that fitness is protected. But in the things that we would measure normally in a clinic, the metabolic panels, the CRP, the glucose, systolic blood pressure, even hepatic steatosis and metabolic syndrome, all of those things are worse in those who are fat yet fit compared to those who are unfit yet fat. So it raises the question, since the mortality data show that those people who are fit fat are protected compared to those who are unfit and fat, do we need to start measuring fitness? Because in the cross-sectional data that we have here, we see that fatness is the main determinant of cardiometabolic risk.